Surviving cancer calls for a big celebration, but doctors are becoming increasingly aware of the toll it can take on the emotional, spiritual, and social aspects of the survivor. So what should survivors do if they're in need of help? Dr. Niraj Gusani and nurse Lynn Fantom of Penn State Health join us ahead of a web chat on survivorship. They're here to offer up resources for patients and their families. That's a good word, survivorship.
Absolutely.
That's such a positive thing. Can you define it for us, like sum it up for us, what that really means?
Sure, Amy. It's a, excuse me, a common misperception that a survivor is someone who has been through all their treatments of cancer and has indeed survived. But in fact, the definition is that any patient who's been diagnosed with cancer is a survivor from that day forward. There are actually over 14 million cancer survivors in this country and projected to be 20 million in just a few years. That segment of the population has increased from 1% to over 5% in just a short time. And so there's an increasing understanding of the needs and a need for all of us to take care of these patients, this growing segment of the population.
So it's more than just the treatment, more than the radiation or the cancer or the surgery at that point. Survivorship is starting there. What does a cancer diagnosis mean for the patient, for the family also?
Sure. Cancer affects not just the patient, but the whole patient's network and their caregivers and their families and so on in so many ways. You start out just with diagnosis, and it can take time to figure out that the patient has a cancer. Then during treatment, we as medical practitioners often focus just on the chemotherapy or the radiation or the surgery in my case. But there's so many other things going on, and we need to support the family, provide resources for outreach, make sure the patient has wellness in terms of their nutrition and getting sleep and being physically active. Smoking cessation is a big thing that will help patients through their treatments,
Sure.
if we can, to decrease complications and help them survive. And of course, after the treatments are over, there are long-term effects that can happen from being a cancer survivor, and we need to have a better understanding of those.
We'll talk about that because you get that last treatment. That is clearly not the end at all. What happens then? What kind of questions do patients have?
Well, I think in today's world, we're really starting to focus on survivorship. So there's going to be, patients are going to be asked, come in for a survivorship visit. I encourage all patients to do that. That's where we're going to check in to see how you're doing emotionally and physically and what leftover side effects that you're experiencing. So you really need to keep that appointment so we can deal with it, and then we have resources that we can help them with. So really, patients will ask, what can I do to keep my cancer from coming back? I've done everything you've asked me to do, but what else can I do? So we talk about the nutrition and the exercise. Also, I think family and friends need to remember that cancer treatment's over, the active part, but again, there's still a lot of recovery to go on, a lot of psychological recovery as well as physical recovery from the side effects of chemotherapy. Some of those side effects from chemo can last for years afterwards. So you can have numbness and tingling, you can have, the depression that goes along with it, you can have fatigue that doesn't go away just overnight. It takes months and even years to disappear. So we need to deal with that and help patients kind of get through that. But family and friends need to remember, you don't just go back to being normal after you're done with active treatment.
And I'm sure that goes for a whole family too. A whole family's been going through this process.